Dr. Doucette, the CDC recently changed its guidance on isolation and quarantine. What can you tell us about these changes, and what is your best advice for residents of St. Louis County who face choices in those areas?
So the CDC did release new isolation and quarantine guidelines last week, really based on emerging evidence about how Omicron spreads differently than previous strains of the virus that we've seen throughout the course of this pandemic. So I think it's really important when thinking about these new guidelines that really everything needs to be interpreted in context. And the context of these guidelines and the basis of the guidelines for isolation and quarantine are all tied to masking. So I think that's a really, really important piece here, that this operating under this new guidance is really focused on the masking behavior of the individuals involved. So we'll break it down a little bit by isolation and quarantine, and just to kind of clarify those terms, because I know they get thrown around a lot. Isolation is focused on separating someone who is ill, right? Someone who has COVID-19. So if you test positive for COVID-19, or if you have symptoms of COVID-19 and you have been around someone with COVID-19, even if you can't get tested, and that can be challenging right now, you should assume you have COVID-19 and you should isolate yourself from other people. So I want to make it clear that isolation is completely independent of vaccination status, right? If you have COVID, you have COVID. No matter how you got there, no matter what led you to that place and whether or not you were vaccinated beforehand, you have infection and you are at risk. You're a risk to other people, those you love and those around you. You're at risk of transmitting that virus for up to 14 days after your first symptom of COVID-19. And that's kind of the longest period of time that we know you could transmit that virus. For the most part, people will transmit the virus within the first 10 days of illness, and increasingly in the Omicron environment, in the first several days or even those first 5 days of illness. So that's kind of why, I think it's really important to put in context that you can transmit that virus for quite a period of time. Most of that transmission is likely to happen early on, but your risk to other people at day 5 or day 7 is not zero. And so it's really important to think about the people that you're around, your loved ones, and what their risk factors are, and frankly, the risk factors for the community broadly. So when I think about this, I really recommend people thinking of this as a 10-day period of behavior modification and isolation to try to support the people that they love and the community as a whole, right? So when you're thinking about that 10-day period, these new guidelines kind of give a course for people who are in certain situations to make modifications to that based on the way that they're presenting with illness and how the illness is individually affecting them. So if you have COVID-19, no matter what, for the first 5 days that you are sick from the beginning of your symptoms, or if you don't have symptoms from the time that you first test positive, for that first 5 days, you need to isolate yourself from other people. That means staying home and not being around other people in your home to the extent that you can manage that in order to protect them from getting sick. So after that period of time, there's kind of two pathways that diverge. One, if you have symptoms of COVID, or if you do not have symptoms, so you're asymptomatic, you feel great, no cough, no shortness of breath, no fever, it is, the new guidelines say that you can leave your isolation, leave your home, do the things that you need to do in your life for the next 5 days, right, for that 6 to 10 day period, if you can maintain masking the entire time you are outside of your home. CDC is currently looking at the requirement for testing at that 5 day mark, right, to determine if it is safe for you to leave isolation and be around other people. So that is not something that is officially recommended by the CDC at this point. DPH is taking the proactive approach and strongly recommending for citizens of St. Louis County that when you hit that 5 day mark and you have no symptoms and you're considering leaving your home, you should get an antigen test And antigen tests tend to be those at-home rapid tests that you can run in 10 or 15 minutes. If that test is positive, you are, the way that we're using that test is kind of emerging, but we believe that positivity of that test is associated with your ability with a high transmissibility or high contagion to other people. So if your test is still positive, you should continue to stay home. And that is a recommendation that we're making at this point for the protection of our community and the protection of those people that you love. So that's if you have no symptoms. If you have symptoms, you need to stay home until your symptoms resolve in that 10-day period. Pretty straightforward. And I think, again, throughout that 10-day period, it's really an important focus on thinking about the things that you're doing and what needs to happen outside of your home, right? If you are in critical infrastructure, right? If you're if you're in critical infrastructure and you really need to leave your home to go to work and that's something that you need to do, there's a path for that through these guidelines. That said, if you can work from home, if you're allowed to and you can do that well, stay home for 10 days, right? And really think about the types of things you're engaging in. I would certainly not recommend elective social gatherings or large gatherings of any kind during that 10-day period. So that's isolation. That's if you have COVID, right? So the other category that's new is quarantine. And quarantine is the word that we use to separate people who are not ill, but have had a close contact with someone who has COVID-19, right? And this, so I think there's something, the thing that is similar to isolation is that, again, this is completely tied to the ability to mask and the masking behavior. The thing that's different is that it is also tied to vaccination status, right? So there are, again, let's say that you have come in contact with someone with COVID-19, you know you've had that exposure, you're feeling well, you're fine right now, but we're trying to determine if you are likely to develop COVID-19 into the future. You can get COVID-19 again for up to 14 days after that last exposure, but it's much more likely in this environment to happen on the much sooner end of that time frame. So I would say at this point for quarantine, there are kind of, again, two separate paths. And there's one path for people who are unvaccinated or people who have had their primary vaccination series, but it was a while ago. And we consider a while ago to be more than 6 months after your Pfizer or Moderna vaccine, or more than 2 months after your Johnson & Johnson vaccine. So if you're unvaccinated or you haven't been vaccinated recently, then you need to stay home for 5 days, even though you feel well. And then you can leave your house with a mask on 100% of the time for the second half of that quarantine period for those second 5 days. The other category, so that's if you're unvaccinated or not recently vaccinated. If you are recently vaccinated or if you are boosted, you're in a separate category, right? And that's our kind of path two. So if you have been vaccinated with the primary Pfizer or Moderna series or the Johnson & Johnson series within the last 6 months for Pfizer and Moderna, or within the last 2 months for Johnson & Johnson, or if you're boosted, right? So you've gotten that either second or third dose of the series, at that point, you do not need to quarantine. You need to wear a mask 100% of the time for the next 10 days that you're outside of your home and limit your contact with people who are high risk. We do recommend that everyone who is quarantined, whether they are staying in their home or not, at that 5-day mark, again, take a COVID-19 test and to try to understand if you have COVID-19 or are likely to get it. And then, of course, at any point, if you develop symptoms, you would definitely want to immediately go home and look for ways to get tested. So I think the really big change here for quarantine is that quarantine at home is now required for people who have had a primary vaccine series a long time ago and haven't been boosted. And that is really completely new to this guidance, and that is focused on the fact that there really is some emerging data coming from internationally in places where those Omicron spikes happened earlier on, that the effectiveness of recent vaccination and particularly boosting is really important to protect people against Omicron.